Please rise as we welcome Her Excellency, the First Lady of the Republic of Rwanda and the Chairperson of Imbuto Foundation, Mrs. Jeannette Kagame. Thank you very much. Your Excellency, First Lady of the Republic of Rwanda, Mrs. Jeannette Kagame, Honorable Ministers, UNDP Chief of Staff and Director of Executive Office, UNFPA Regional Director for East and Southern Africa, representative of UN agencies, heads of international organizations, fellow African young people, ladies and gentlemen, all protocol observed, good morning. Bonjour. Mwaramutse. My name is Anshtaina Ndizeye, a medical student at the University of Rwanda and a passionate Afro-optimist. I'm very grateful to be your MC today. This session will focus on universal health coverage, looking at the linkages between good health, personal well-being, productivity, and economic growth. We will take a very close look at how SRH and mental health are interdependent and interconnected throughout the course of life. So a very, very warm welcome to you all, and I think you deserve a round of applause to welcome each other to the session. To kickstart our session, I am pleased to invite our very own Honorable Rosemary Mbabazi, Rwanda's Minister of Youth and Culture, for her welcome remarks, and she will introduce our next speaker and invite our guest of honor.
Good morning once again. Bonjour. Good morning again. We don't hear the energy in the house. Good morning. Good morning. That's good. Thank you so much. Your Excellency, Mrs. Jeannette Kagame, the First Lady of the Republic of Rwanda, Honorable Augusto Gomez, Minister in charge of Youth, Culture and Sports, representing His Excellency Umaro Sissoco Embalo, the President of Guinea-Bissau, Honorable Lydia Zigomo, UNFPA Regional Director, East and Southern Africa Region, Honorable Ministers and colleagues from African countries, Executive Director of Youth Connect Africa Hub, the representative of OIF present in our midst, heads of development partners and representatives of institutions, distinguished guests, young people of Africa. It is my great pleasure and honor to welcome you all to this important session, investing in young people's health, accessing sexual and reproductive health, and mental health. Guests and participants of this session, allow me to extend our appreciation to Her Excellency, the First Lady of the Republic of Rwanda, for her immense support towards empowering our young people. Your Excellency, we are very grateful for the time dedicated to the African young people, and we appreciate that out of your busy schedules and other priorities, you chose to be with us, not only for this session, but also for the entire programs of youth empowerment in our country. I request you to give her a round of applause. Through her organizations, Imbuto Foundation and the Unity Club, she supports and strives to nurture a strong and grounded, stable family as a foundation for sustainable development. She supports children, youth, and vulnerable members of our society, mainly the women and widows who survived genocide against the Tutsi. We are so grateful for the vision, the mission, and the values inculcated in our youth and the country at large. Today's session aligns with the broader vision of the Africa we want. What is it that unhealthy youth can achieve? As we all know, a health nation is a wealth nation. I wish to quote His Excellency, the President of the Republic of Rwanda, when he met with young people way back in 2009, he said, I quote, "Youth, you are the strength of today and tomorrow. As you build yourselves through education and gaining skills, you have to begin by being healthy. That is the foundation. We need you to be healthy. We must be sure that the investments we have made are long-lasting." I end the quote. This is therefore a challenge to you, young people, to take right decisions that will ensure a better life today and tomorrow. Your future is built today. The choices of today affect the life you lead tomorrow. Always think beyond now. Select wisely and surround yourselves with people of positive values and positive thinking. Build a retrospective life. That is a life that is assessing and doing a self-evaluation at the end of every day about the decisions you took today. This will help you to make choices. And these are decisions that are simple as making a right decision or making a decision of where to go, what time to wake up, what to post on your social media platforms, because those become your identity. And many more small choices and decisions we make today can influence and make a long-lasting impact, whether positive or negative. When you are entangled in a cycle of failing to make right choices or decisions, open up to someone you trust, could be a professional counselor or a trustee, a role model, to help. Allow me again to end my remarks by thanking and deeply appreciating our esteemed partners, particularly Imbuto Foundation and UNFPA, for leading us on health thematic areas in our joint youth program in Rwanda. This session is expected to sharpen the attitude and choices of our young people gathered here in our country in terms of understanding the connection between a better health and tapping into socio-economic opportunities that our continent offers. I want to thank you very much and wish you fruitful deliberations. As I was requested by our moderator, I wish to invite my colleague Minister Honorable Augusto Gomez, Minister of Culture and Youth and Sports, representing His Excellency the President of the Republic of Guinea-Bissau, who was not able to be with us, but delegated our colleague. My colleague, the floor is yours. Thank you very much. Let's give him a round of applause as we welcome him.
Bonjour. My French and English both are not so good. I am a Portuguese speaking. As we have no translation available in Portuguese, I'm trying in French. Bonjour encore une fois. Je vous salue au nom de Son Excellence, Général Umaru Sissoko Embalo, président de la République de la Guinée-Bissau, président en exercice de la CEDEAO. Je salue en son nom Madame la Première Dame. Je salue la ministre de la Jeunesse de Rwanda, qui nous a invités à participer à cet important événement. Je salue, cher ministre de la Jeunesse, je salue les jeunes entrepreneurs, je salue tous les participants à cet important événement. Je salue tous les participants qui sont réunis dans cet auditorium. Être présent entre vous, c'est un honneur pour nous. Et Son Excellence, le Président de la République, compte tenu de son agenda, il n'a pas pu participer comme il voulait à cet événement, de joindre à cette importante initiative pour encourager les jeunes entrepreneurs de l'Afrique entière et particulièrement les jeunes entrepreneurs de la CEDEAO et de la Guinée-Bissau. De féliciter en son nom, dans un premier moment, à cette initiative de la création de Youth Connect. Cette initiative, c'est une lumière pour l'Afrique, c'est une lumière pour l'espoir de l'Afrique, la jeunesse. La jeunesse, c'est notre continuité, c'est notre espoir. Et la jeunesse doit être toujours capacitée pour prendre ce rôle de garantir la continuité de notre Afrique et de chacun de notre pays. Donc cette initiative de Son Excellence le Président Paul Kagame, c'est une initiative auquel tous les pays de l'Afrique doivent se rejoindre et renforcer et travailler dans le sens de garantir tous les aspects, tous les résultats qu'on peut attendre. Son Excellence le Président Ambalo félicite la célébration du 10e anniversaire de cette initiative et félicite l'organisation de cette 5e édition du Youth Connect. La Guinée-Bissau était participant dans toutes les éditions en tant qu'invité et cette fois nous sommes là, mais déjà en tant que membre de Youth Connect. Nous sommes participants avec 2 jeunes de la Guinée-Bissau, une fille et un garçon, qui ont des idées et qui ont développé leurs idées et qui sont en train de travailler avec d'autres jeunes de la Guinée-Bissau. Nous pensons que l'initiative Youth Connect doit être appuyée pour tous les États, doit être un objectif de toute une Afrique qui veut un changement positif, qui veut un moment de changement de paradigme de ce que parfois les gens pensent sur l'Afrique. J'écoutais hier et j'ai aimé toutes les communications qui ont été menées dans la cérémonie de l'ouverture. Là, on était en consensus que l'Afrique n'est pas un continent de problèmes. L'Afrique peut avoir des problèmes. Et les problèmes, on les trouve partout. Mais l'Afrique doit se regrouper pour travailler ensemble et rendre le développement que nous souhaitons pour notre pays, auquel nous sommes capables de mener. Moi, je pense que ça commence par la jeunesse. Et par rapport aux jeunes, je lui dis qu'il n'est jamais trop tard. Même si dans notre État, un peu partout, la priorité pour les jeunes était toujours une question de la rhétorique, mais il est au moment de passer de la rhétorique à les actions. On sait qu'il y a des défis, mais les jeunes doivent faire face à leurs défis pour les soulever et rendre capables de provoquer un développement. Les conditions pour que les jeunes puissent prendre dans leurs mains le développement de chaque pays et de l'Afrique entière. La question de financement, quand on passe par tous les panels, on va comprendre que les jeunes ont des idées, les jeunes ont des initiatives, mais quand ils partent pour aller implémenter leurs initiatives, ils se confrontent avec le problème du financement. C'est vrai qu'il y a d'autres problèmes, mais le principal toujours, c'est le problème du financement. Et le problème du financement doit être vraiment à notre pensée la responsabilité de chacun de notre État. Ça passera à notre vie pour la création de fonds, de garanties pour que les projets des jeunes soient toujours bancables, financiables. Les banques, jusqu'à là, un peu partout, ils n'ont pas de produits adéquats à la situation des jeunes entrepreneurs. Mais l'État peut venir en garantie en créant des fonds pour que les jeunes puissent avoir assez financement. Donc, nous pensons que les activités génératrices de revenus doivent être encouragées par notre État. À un certain moment, dans les États de l'Afrique occidentale, on a essayé de créer ce mécanisme. On a créé une banque qu'on appelait Banque régionale de la solidarité. C'est une banque qui a été créée à partir de fonds des États de l'OMOA. Mais ce projet a échoué parce que les États n'ont pas pu garantir le financement des ressources concessionnelles pour que les banques puissent octroyer les crédits bonifiés à la population et surtout les jeunes et les femmes. Mais on peut reprendre avec l'initiative Youth Connect et travailler dans le sens de donner cette garantie des fonds, des contrats garantis pour les projets des jeunes. Donc, je profite de cette opportunité pour encourager les jeunes de ne pas s'arrêter en face aux défis, mais d'essayer et d'essayer. Les jeunes doivent se mobiliser, créer une autoestime, confiance à eux-mêmes et de travailler en réseau pour soulever les défis. Mais les pays, les responsables politiques, la famille, à notre vie, doit donner toujours les opportunités aux jeunes pour travailler, pour développer leurs capacités. Parfois, on infantilise beaucoup les jeunes. Il faut les éduquer, il faut les orienter, il faut les discipliner, mais il faut les laisser travailler eux-mêmes. Il faut leur donner la responsabilité. Il faut leur montrer qu'ils ont le droit d'une part et qu'ils ont une responsabilité de l'autre part. Parce que si on reste dans cette dynamique d'infantilisation des jeunes, ils ne seront jamais plus capables de prendre dans leurs mains le destin que nous souhaitons pour l'Afrique entière. De les créer les conditions, en commençant pour les donner des garanties de santé, les garanties d'une éducation pour la libération d'eux-mêmes et de leur donner tous les mécanismes pour développer leurs activités. Madame, je vous remercie infiniment pour l'opportunité. Son Excellence le Président Ambalo m'a demandé de saluer Son Excellence le Président Paul Kagame et sa famille, le gouvernement de Rwanda, tous les partenaires de Rwanda et tous ceux qui sont regroupés dans l'initiative Youth Connect. Je vous souhaite le mieux.
Merci beaucoup, le ministre. That's where you stop. I'm still a student. Hopefully next year I'll be speaking very well. Thank you so much, Honorable Minister, for delivering the speech on behalf of His Excellency, the President of Guinea-Bissau. Convey our appreciation. Thank you so much. I want to take this opportunity to invite Her Excellency the First Lady, who has an organization, as I mentioned earlier, several organizations, but one of them that we work very closely is Imbuto Foundation, that has been very instrumental in working together, organizing Youth Connect, Africa Summit, and also implementing Youth Connect in Rwanda as a country chapter. They have been key partners from the beginning. And this organization is also spearheading and leading on driving sexually reproductive health and mental health, complementing what the government of Rwanda is doing. They have been doing a lot of work. I think we'll have time to hear more in this session. And I want to take this opportunity to allow me to welcome Her Excellency, the First Lady, and our guest of honor to deliver her remarks.
Please have a seat. Thank you. Before I forget, Monsieur le ministre de la Guinée-Bissau, veuillez remercier Son Excellence, Monsieur le Président de la République de la Guinée-Bissau, pour votre discours combien touchant. It's so nice being around and among the youth, and I promise you the vibrancy is contagious. So despite the seriousness of the topic at hand, I can feel some hope among the youth. Trust the youth of our continent to bring energy and vitality to our pursuit of development. Before me are people that make every sacrifice of the past infinitely worth it. What a beautiful, promising youth. I hope you are enjoying being in Kigali and will take some time to discover a little more of what Rwanda has to offer outside the Youth Connect Forum. Today, we connect through addressing a vital theme, sexual and reproductive health, mental health, and how frequently the two interact. The Africa we want is one led by healthy, ambitious, empowered, creative, innovative, educated youth. So to get to this dream state, we must look at the full developmental picture, leaving no problem unattended. I applaud Youth Connect Africa Summit and all its strong partners for providing such a lively platform for conversations and sculpting cornerstones for a united youth in the common goal towards Africa's progress. Dear youth, we are living in a decisive transitional period. The current news will at times feel heavy, as if the world itself is coming to an end. A global pandemic with millions of deaths, political conflict across the world, wars, displacement, dehumanization, ever-deepening social and economic inequalities, some unkind but pointless words spoken about our own countries, jabs that aim to challenge who we are and our dignity. Food crisis, climate change. But dear youth, despite the tragedies in all these challenges, it isn't the world that is coming to an end. It isn't the progress of our societies that is coming to an end. It is the period where emerging nations are discouraged to center themselves and prioritize their own growth on their own terms that is ending at last. It is the period where unsustainable development across the world is promoted for the sake of the wealth of a few, despite its impact on the planet. That is coming to an end. It is the era where African youth couldn't take center stage in influencing the future of science around the world, of technology, of education, that already has come to an end. May all that be replaced by a kinder, more equitable world, one where neither resource misallocation or political greed or disease that our systems are unprepared to tackle can lead to conflict and social fragmentation. May you, the youth, be granted by all our present efforts the drive, determination, and wellness to thrive and build this world we desire for you and the generations beyond you. Dear youth, despite your vitality, your energy, your optimism, we acknowledge that the problems you face are plenty, some of which are almost unknown to us. The world stage has become tactile screens through which the youth is often targeted with unrealistic, intimidating standards of life and beauty, and the encouragement to engage in impulsive instant gratification, self-isolation, and at times even individualism. We must not let excessive screen tapping or decadent fun, these ghosts of real engagement, replace the organic joys that we once held dear. The anxiety that they can induce shouldn't win over the enriching pleasures that are still within our reach. The joys of a friendly sporting match among friends, of discovering new art, of a healthy intellectual exchange, or voluntary community work and the pure fulfillment it can provide. You'll find that there is a little replacement to truly nourishing happiness in the form of investment in one's mind, spirit, body, and environment. For us, the public figures, whose platforms can in fact change, the way forward is clear. The statistics point to the work ahead. Access to sexual reproductive health and mental health services are impossible to separate from each other. Survivors of sexual violence are 3 times as likely to experience major depressive episodes as those who have not gone through such a traumatic experience. Adolescence is described by some medical experts as just a chronic stress exposure due to sometimes aggressive hormonal fluctuations, rapid bodily changes, and social pressure. And in East Africa, 21% of young girls are exposed to mentally damaging early sexual initiation at the risk of disease and teenage pregnancy. An estimated 100 million Africans suffer from clinical depression, almost 2/3 of whom are women of reproductive age. It turns out that 1.1 billion women across the world have an unmet need for family planning services. If this number alarms you, it's because it absolutely should. We can only imagine the amount of people that beyond unwanted pregnancies developed disease yearly based on this number alone. These statistics have a palpable impact on many sectors of our progress. For instance, health and education fuel each other in a cyclical fashion. Many studies attest to this, but let's look at it on an individual level. Look back on any point back in your education, and I'm sure all of you were top of the class. Trust you, all parents have been top of the class. Now, as well as you performed, ask yourself how that performance would have been impacted if you had suffered from a disease that kept you from attending class, and this in the long term. How well would you have been able to absorb lessons or to perform on tests? Could this have held you back from evolving from the years at the same rate as your schoolmates? The fact is, healthier lives are typically more educated lives. And to live longer and better is to have more time to educate oneself and a foundation of well-being that facilitates processing this learning. With better education, income earning opportunities are greater, which means that an educated country has more money to invest in education. Health and education meet where progress begins. So how do we protect and prepare our youth? Dear youth, I can say honestly that we are actively working to keep you empowered, and you can help us by joining our nationwide and continental efforts, including those of non-governmental institutions and individuals. My foundation, Imbuto, that I chair, started, as some of you know, as a project called PACFA to hold the transmission of HIV from infected mother to child. But the country has come a long way in this respect, fast. So Imbuto Foundation needed to be strategic in its expansion to remain relevant, to effect real change and have a lasting impact on the entire life cycle of the population that we were serving. And today, we are pleased to say that our foundation's family planning campaigns have reached over 600,000 Rwandans. Our adolescent sexual reproductive health and HIV care and prevention services have catered for over 300,000 Rwandans. And 75.5% of pregnant teens in our area of intervention have been counseled and provided with support to reintegrate into their societies and reconcile with their families. And as for the mental health care, we understand that the needs of youth should not just be reduced to hormonal imbalances or trauma. Some problems are structural. How can we holistically uplift you all so that the future is bright for you, so that less of you identify with anxiety for the future and even depression? Imbuto chooses to invest in youth with time, effort, and yes, financial resources. We are pleased to have now provided seed funding for 11 organizations in the field of mental health and adolescent sexual reproductive health. We actively encourage practices which cater to your overall wellness and therefore your mental well-being. Our country's Car-Free Day, which is going to take place on Sunday, and I'm inviting everyone, and the development of state-of-the-art sports complexes are examples we cannot wait to share with you, including our soon-to-be-launched multifaceted sports facility, a partnership between Imbuto Foundation, the Ministry of Sports, BAL, and the City of Kigali for a modern community playground. Stay tuned for more details on this promising project aimed at targeting specifically for the youth. Dear Youth Connect participant, there is much more I could say to you about the Foundation's work and vision, including our provision of counseling and therapy under our health division and our many educational programs, but I hope you'll find out more during this summit. So instead, I'll take this last moment to thank you for your interest and in connecting with youth from all over the continent. These aren't the easiest of times, yet the light of dawn has already broken, and we can once again reunite physically to share these moments of necessary exchanges and interaction. Now, dear youth, it's imperative that you be your brothers and sisters keepers and ensure that everyone in need of a helping hand has one extended to them. I trust that you will do great. So again, dear friends, as I bid you goodbye, I hope, in fact, I'm confident that we are all determined to do our part to ensure the healthy, happy progress of our communities, nations, and continent. Our valued youth, thank you for having me today. It was lovely speaking to you. Thank you.
Thank you very much, Your Excellency, First Lady, for your inspiring insights, your unwavering support to young people, and for gracing us with your presence today. Ladies and gentlemen, to set stage for the upcoming panel discussion, I am pleased to invite Michael Makembe. He is a talent nurtured by Art Rwanda Ubuhanzi, an initiative of Imbuto Foundation, in partnership with the Ministry of Youth and Culture, the One UN Family, and COICA. Let's please put our hands together and welcome Michael. Michael, the stage is yours.
My name is Michael Makembe. I'm a creative artist from Kigali, Rwanda. I'm very glad to perform my creative art piece and very blessed to be part of the family of Imbuto Foundation in their program called Art Rwanda Ubuhanzi that brings the creative of Rwandan youth together. I'm going to perform a song called Tajebon, and I hope you love it. tajebon, dene tajebon. Nita tajebon, dene tajebon. Habdu bujambal, nyali malaikala. Hawe he chiko, dalo siselu. Munila degam dulinga munila degam wonga. Chico, dalo siselum. Munila degam dulinga. Munila degam wonga. Tajebon, dene tajebon. Dene tajebon, tajebon, dene tajebon, dene tajebon, tajebon, dene tajebon, dene tajebon, tajebon, dene tajebon, dene tajebon. Uwalay. Iwalay, Iwalay, Iwalay. Iwalay, 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 Iwalay. Help me. Iwalay, Iwalay, Iwalay. Abdu Jambal, nyali malaikala, chika yule ichuge, alu siselu. Abdu Jambal, nyali malaikala, chika yule ichuge, alu siselu. Tajebon, dene tajebon. Thank you so much. Thank you.
What a talent, what a performance. Another round of applause for Michael, please. Distinguished ladies and gentlemen, please allow me to welcome my sister, Lauren Wamaitha Kamoya, all the way from Kenya, who's going to moderate the next panel discussion. Thank you very much.
Okay. Good afternoon, Africa. Good afternoon, Africa. Thank you for joining us today. Excellencies, ladies and gentlemen, all protocols observed, Youth Connect Africa delegates, Mwiriwe. Welcome to the second day of the Youth Connect Africa Summit, and we are here to discuss, to have a conversation on the urgency of sexual and reproductive health and rights, mental health, and economic empowerment. My name is Laureen Wamaitha. I am from Kenya, a global health advocate, and I'm here representing UNFPA Kenya Youth Advisory Panel. And to start the panel, to start this conversation, I would like to just welcome and call on stage our powerful panelists that we have for you, who have extensive experience in the conversation we are about to have today. So kindly put your hands together as I mention their names and as they walk towards the floor. A big round of applause. And so our first panelist is the Minister of Information, Youth, Culture and Sports for Zanzibar, Honorable Tabia Maulid Mwita. Kindly a round of applause as she comes. Thank you very much. You can do better. The vibrancy and the energy that is in this room, you can do better. Our second panelist is Dr. Christelle Giraneza, an eye accelerator innovator of the Urukundo Initiative on Sexual and Reproductive Health and Rights. She's followed by Honorable Emma Kantema Gaumas, the Deputy Minister of Sport, Youth and National Service, Namibia. And our fourth panelist, thank you very much, is Dr. Jean-Pierre Dajijimana, a senior clinician for Solid Minds with extensive experience in mental health. And our last speaker of the day is Mr. Charles Tumwebaze, the chairperson of the Africa Youth Network on Population and Development, all the way from my neighboring country, Uganda. Thank you very much. And I'm so delighted to see all of you here, eager to engage and share with us on the nexus between sexual and reproductive health rights and mental health and economic empowerment. The urgency of these three issues in this decade of action cannot be ignored. And so we are very happy to have you here with us as we try to find ways we can be able to ensure that adolescents and the young persons in this continent of Africa are not left behind when it comes to health. Thank you. And so before we dive into the conversation, I would just like to give each and every one of us a context of what the situation is on sexual and reproductive health rights, mental health, and economic empowerment. And so nearly 37 million adolescents live with a mental disorder in Africa. And according to the World Bank data, in 2019, Lesotho, South Africa, Eswatini, Botswana, and Zimbabwe are among countries with the highest suicide rates in the world, ranging from 14.1 per 100,000 in Zimbabwe to 72.4 per 100,000 in Lesotho, the highest suicide rates in the world. And these are not just numbers and statistics. These are human beings. They are the present and the future of Africa. In addition, there is an emerging body of research exploring the intersection between mental health and sexual and reproductive health and rights in both development and humanitarian settings. The evidence shows that poor mental health can be a driver of negative sexual and reproductive health rights outcomes, and an inability to fully realize one's sexual and reproductive health rights can in turn result in negative mental health outcomes. And so these numbers, these issues especially affect the adolescents and young people. For example, in the context of HIV, depression, anxiety, stress, and HIV-associated neurocognitive psychosocial impairments, they remain a significant burden that is further aggravating the well-being of this special population, which is actually the majority of the population in Africa. Moreover, it is also documented that pregnant adolescents in sub-Saharan Africa are 2 to 9 times more likely to develop perinatal depression. I think we can all see how serious sexual and reproductive health rights, mental health, and economic empowerment are. And last but not least, half of all mental health disorders in adulthood start by age 14, but unfortunately, most cases are undetected and untreated. And therefore, this panel we have here today will be discussing that intersection between health and economic matters. And as it has been echoed here today, that good health translates to improved wealth of the African continent. And so we are going to discuss on the impact of sexual and reproductive health rights and mental health, and why we need to empower the young people economically and invest in the health of young people to allow us to achieve the Africa we want in this decade of action. Thank you. Thank you very much to our speakers. And so I'm going to start with Honorable Minister Tabia Maulid. Thank you for joining us here today. How are you doing?
Fine, thank you.
I'm glad you're fine. And we are very interested to hear from you on what is in place in Zanzibar to ensure that young people access sexual and reproductive health rights services to avoid the pandemic of teenage pregnancies.
Okay, thank you so much, everyone. Thank you, Madam Moderator. Thank you, all participants, First Lady of the United Republic of Rwanda, senior government officials, representatives of, from UN, all organizers and sponsors, all youth representatives, and all ministers who represent youth in different African countries, good afternoon. Nawasalimu kwa Jamhuri ya Muungano wa Tanzania, kazi iendelee. Thank you. It is clear that to all of us, there is a direct link between sexual reproductive health and also mental health. And I'm sure most of us here will agree with me that young people in the continent are facing many challenges, including child marriage, teenage pregnancies, HIV and STI infections, gender-based violence, domestic violence, and other issues that lead to the young generation to face psychological problems. But as you said, let me go direct to your question, to what extent Zanzibar or Tanzania are trying their best to acknowledge, first of all, that there is a need for the young people to have sexual reproductive health, and also the importance of young people to be educated in most areas where they can be able to stand by themselves, to defend themselves, and to make sure that by using different youth agencies and development partners, those young people can be able to create their chances to employ themselves and not depending on the employment of the government, so that they can be mentally active and finally being economic well. In Zanzibar, first of all, we are having a structure of 3 areas so that we make sure young people can get the social reproductive health education. And first of all, it is starting in family stage. Those family members are required to provide awareness at home, which means family members to sit down with their children, and give them the education on how to prevent themselves against the changing, global changing, social changing, cultural changes, and so many things that surround that young generation. But also, second stage, in our country, we involve those cultural sectors, like, for example, spiritually, some elders from the different community in Zanzibar, so that they can provide the curriculum and the sessions for young people to educate them about the importance of sexual reproductive health, spiritually and culturally. And the third stage is in the government itself, where we have ministries, like my ministry. We have tried our best, first of all, to improve youth policy, where those young people get the opportunity to contribute on what to be done, so that social reproductive health can be taught in many sectors. Like nowadays, from 10 years, we start in upper primary school, secondary school, to teach all students about the importance of sexual reproductive health, about how to prevent themselves from early pregnancies and other calamities like HIV and and other things. So in Zanzibar, I can say, also we have Youth National Council, where young people can have the opportunity to sit down and express the ideas to the government on what to be done so that they can be prevented with their nation. So thank you very much for now. Let me give you that explanation, but without forgetting, let me take this opportunity to thank and appreciate and recognize high contribution from our development partners. UNFPA, UNDP, UNICEF are helping us a lot in our government so that we can proceed with helping those young people in sexual reproductive health. Thank you so much.
Thank you very much, Honorable Minister Tabia Maulid. Indeed, there is hope. There is hope for the young people, for the adolescents in Zanzibar, in Tanzania, and in Africa and beyond. And so, hi, Dr. Christelle.
Hi,
How are you doing?
I'm doing well.
An important strategy when working for young people is to do so with young people themselves. Can you share with us any ideas on how to facilitate young people's access to sexual and reproductive health rights as an innovator?
Thank you so much, Sister Lauren. So I want to first start by appreciating and also being sincerely grateful. It's such an honor for me to stand here and be part of this panel discussion. As a young person, as a young lady, and also as a young sexual and reproductive health activist and advocate. And I also want to take this opportunity to give my reconciliation and also be thankful for the First Lady of the Republic of Rwanda, Jeannette Kagame. She's one of my biggest role models, and I truly admire her. And it's because of how she believes in young people, and especially girls. And through Imbuto Foundation as the chairperson, together with Imbuto Foundation partners, they always find ways to empower girls and to empower young people and believe that we have skills and potential. So I'm grateful and thankful as well. So responding to you, Sister Lauren, so one of the ideas is actually starting with us, young people. So as a fresh graduate in medical school, I can really testimony about that. And then one of the ways is actually investing in broader range of innovations and technology. At Urukundo Initiative, following UNFPA recommendation, that sexuality education can be provided through games and role plays, we came up with Urukundo Life Skill Board Game, which was a game that we created throughout Innovation Accelerator program brought by Imbuto Foundation, and that's where we started. And the young people in the room, I'm telling you, that was the first door which opened for us. And our game became an award-winning game. It was users tested, and with the help and the support of the government, it got validated. It got at doorsteps of many families and schools, and it helps to create that bond between parents and children, and also improve parents and children communication on big matters of sexual reproductive health and mental health. And trust me, those issues are like myths and taboos, and not only in Rwanda, but also in the African continent. And through that innovation, we're able to see that young people have innovations, and they have skills and potentials to deliver. All they have to be given to is an opportunity to express themselves and explore those potentials. And through different many programs, like the Innovation Accelerator program, young people in Rwanda are given that opportunity. And it's seen that in schools, as Honorable said, comprehensive sexuality education is there, but I welcome young people in the room to think about innovations and educative tools that can be used, because they open up a platform to interact on such matters. And I would also like to take this opportunity to thank UNFPA Rwanda, Koika Rwanda, and the Ministry of Youth, Sport and Culture of Rwanda, because they supported different programs which are also brought by Imbuto Foundation in order for young people like me to stand here and testimony how preventive health is as far much important as curative health. And I'm telling you out of experience, I'm a fresh graduate medical doctor, and I'm telling you investments are required in all fields. Thank you.
Thank you very much, Christelle. Indeed, we cannot progress, we cannot accelerate the Sustainable Development Goals, and especially sexual and reproductive health rights, without innovation. To Honorable Emma Kantema, we are honored to have you here today. And we are honored to have you here today and for you to share the work that the government of Namibia is focusing on to ensure that young people are not only empowered economically, but also healthily. Would you please give us a few examples of what is in place in Namibia for that to happen, especially now that Namibia has started the Youth Connect Africa Namibia chapter?
Thank you very much for the opportunity. I bring you greetings from Namibia, the land of the brave. I'm pleased and excited to be here and listening to Her Excellency Ms. Janet Kagame speaking about what the Imbuto Foundation is doing. As a leader in the youth sector, I was filled with hope, knowing that, as Ms. Kagame has mentioned, no problem is left unattended. And I think she really deserves a round of applause. I would like to preamble my input in terms of what we are doing in Namibia by saying that sexual reproductive health and economic issues are not mutually exclusive. And I'm very glad that Youth Connect Africa has identified sexual reproductive health as one of the areas to focus on. In Namibia, we have elevated the issues of sexual and reproductive health as it's permitting through at a policy level, program level, and is also featuring prominently in our partnership activities, especially in terms of activities that we are being supported with by UNFPA, including other civic society. The National Youth Policy, of which our President, His Excellency Dr. Hage Geingob, spoke yesterday during the official opening, has a pillar that speaks and focuses specifically to youth and health. Now, in terms of this pillar, we have identified strategies how to achieve the objective, that of providing sexual and reproductive health. And one of the issues that we identified to tackle, which is a problem, is the accessibility part. And in terms of how we ensure that we provide this very important service to the youth, as a ministry that's entrusted to empower the youth, in Namibia we have what we call adolescent and youth-friendly clinics. These clinics are spread over the country. We have around 6 of the clinics that then offers and serves as a safe space for the youth to access sexual and reproductive information, including services. It's very key to mention that this service that we render also focuses on out-of-school youth, because we do know that, especially for the youth who are in school, there's comprehensive sexuality education that's being provided. So towards this end, as a ministry, we've also developed a comprehensive sexuality education manual that speaks to out-of-school youth. In terms of ensuring that the youth or adolescents, especially the girls, remain in school, the Ministry of Education, Arts and Culture have developed a pregnancy policy that falls under Education for All. Because as we are linking the health and economic opportunities, it's very important that we ensure that our girls remain in school, because it then increases their chances to be economically active and to be productive citizens. In addition to the youth-friendly clinics that we offer, at a program level, we have a program that we collaborate with the UNFPA, Safeguarding Young People. Again, this is an opportunity for us to ensure that we reach out to the young ones to provide the service, especially where we do not have the youth-friendly clinics. We then conduct the outreach mobile clinics together with our condomized activity. And to end also, I would like to mention that we collaborate with the Office of the First Lady under her program, the Be Free. And I'm happy to note that Her Excellency Ms. Kagame joined us. I think that was in 2020. She joined one of our sessions. These are sessions that we have for the youth at a non-judgmental platform, because we often hear that adults are not speaking to the youth about it, and there's also that need to destigmatize sexual and reproductive health education. And lastly, I would like to mention that we've also gone a step ahead to ensure that sexual and reproductive health involve community. Because what we see, it's good and well, we can provide this information, we can provide the service, but when the youth go back in their community, the aunties right there, the uncles, will tell them, no, there's no need for birth control, there's no need for protection in terms of preventing HIV/AIDS and other STI spread. So we really need to also address the community involvement part. And thank you very much. And as Namibia, we continuously seek for ways to ensure that we empower the youth, not only economically, but holistically, because we believe that Africa relies on the youth of today. Thank you.
Thank you very much. Indeed, policies, programs, and partnerships are the way to go as we continue addressing sexual and reproductive health rights, mental health, and economic empowerment. And to Dr. Jean-Pierre, let's reflect on the young people's mental health. What is the current situation? And as we seek to promote mental well-being in young people, in your view, how can integrating mental health in sexual and reproductive health rights programs improve the health outcomes for the young people? Thank you.
Mental health. Mental health. What does come to your mind when you hear that word? Mental health. So the integration of the two, first consider this. What affects the brain affects the body. What affects mental health affects sexual and reproductive health. What affects sexual and reproductive health affects mental health. And I appreciate how speakers have brought those together and are starting to think. It is not starting, there has been a journey towards that, because there has been for too long a dualistic approach of thinking about mental health separated from physical health, thinking about mental health separated from sexual and reproductive health. And I think one of the reasons is probably that we have not been able to understand mental health as it is. Our understanding of mental health is related much with the stigma associated with it rather than what it is in reality. And I want to appreciate what has been done so far. Last time I was also honored to speak at CHOGM, and the topic for that day was rethinking mental health. And allow me to quote the words that were shared in that space. It's been many years since I have been a part of the mental health work, and I can feel the hope that I never had before when trying to advocate for mental health. When I said I want to quote and thank Her Excellency Mrs. Janet Kagame on her remarks on that day, on June 22nd, 2022. Part of what she said was, we are gathering under the reality that as we speak, according to WHO, 1/8 of the people we know, 1/8 of the people we love is affected by mental health problems. Now, as I'm going to repeat this text, this quote, I invite you to think of that one. When I say one, think about someone here in the room. Sometimes we think about mental health and we don't think about us, about ourselves. We think about hospitals and we think about some people that look in a certain way. But when, again, I invite you, when I read these, that one, when I say one, think about yourself. Actually, not someone else. Everyone here experiences stress. The only time you do not experience stress is after we say goodbye, when you are no longer with us. When I'm no longer with you is when I will be free from stress. But I'm not talking about mental health disorders then. Not everyone has a mental health disorder. But we experience mental health disorders after a long accumulation of stress. It doesn't come overnight. Back to the quote. We are gathering under the reality that as we speak, according to the WHO, you, myself. It's about us. One. Let me repeat. We are gathering under the reality that as we speak, according to WHO, 1/8 of the people we know, 1/8 of the people we love. So if we have 1 out of a number of people around you, 1 out of the people you know, 1 out of the people in your family, in your classroom, your co-workers, people in the room on the same row. When we talk about mental health, we are talking about us. If I can ask, or something I have been observing in a clinical practice, when it comes to entrepreneurship, what does it require? Entrepreneurs. Tell someone else next to you 1 word of what it requires to be a good entrepreneur. All right. Ideas. Someone else? All right. All of those and more things that people here are thinking. Can you have the ideas without mental health? How does that look like? I want to appreciate, as I finish the quote by Her Excellency Janet Kagame, I appreciate the work that has been done in this holistic approach of looking about mental health, not just as this is something that is here on the top, and this the rest of the body as if it is the transportation of the head. It is not true. That's why when we are thinking about mental health and those initiatives I've been observing with Imbuto Foundation and the others, when you all think about businesses, entrepreneurship, it has to be with mental health. When you think about health, sexual and reproductive health, it's connected to mental health. But then what is the mental health? A few things, a part of it. We don't know yet what really mental health is, and I think we need to appreciate that. And the reason we know part of it is that mental health is what is helping us think. Why did you come here? Why did you come here? Mental health is what supports us to think. Thinking is the mental health. Imagine yourself not being able to think. Those creative ideas you have because you have a good mental health. Mental health is about the feeling. Those feelings you have, the joy, the romantic relationship and how you express them, it's about mental health. If you didn't know how it contributes, then you will know when you see someone in a relationship and then the mental health isn't working well or they are stressed out, something is suffer. Mental health is how we react. The gesture I'm using, the choices you made, the clothes, these colors, the words I'm choosing to use and not the other one. That is the mental health. So when we stigmatize mental health, we stigmatize ourselves. We stigmatize our abilities. We stigmatize our potentials. And now thinking about connecting to sexual and reproductive health, what is it? Part of it, I'm not an expert on it compared to many others who, especially those who have been victims related to sexual and reproductive health. I believe that those with experiential knowledges are the experts of those experiences when it comes to that topic. But let me say a little thing. Sexual and reproductive health being about the freedom and the right to choose or to decide who you have sex with, how to avoid sexually transmitted diseases, how to avoid unintended pregnancies. So when then we get drunk, think about the definition of mental health. It's about how we think, we feel, we react, we make decisions. And I'm just talking about the thinking. The rest, there's also other factors. So when the mental health thinking, the feelings, the reactions, and decision-making is impaired, when you have a heightened stress, when you have a high level of stress, your capacity to judge, your capacity to make good decisions is impaired. The sexual violence, or maybe engaging in an unprotected sex, or even that feelings. Talking about one of those issues we see is people feeling like they have lost everything and they have nothing to lose, so it's okay to have that unprotected sex. We see that in the clinical settings and in the outreach. So when it comes then to coping and working with these depressions, which we are seeing as the numbers have been shared, it's alarming on our continent. When it comes to depression, more than 100 million, as was shared. And the women being more vulnerable to the depression, now you can see the interconnection. More than 66 million among the 100 million in Africa, 66 million are women and in sub-Saharan Africa. So you can also connect to that. Subsistence abuse, subsistence use in Africa is also a big problem. And when you bring it together with depression, one is causing another and the other is making the other worse. And we are seeing alarming statistics like recent numbers of 42% of youth in sub-Saharan Africa. And a recent study showed that youth are engaging, those number among those who were surveyed, 42 were using drugs, any types of drugs, or that abuse those others, that's alcohol. When I say drugs also, allow me to say alcohol and other drugs, because it can be toxic itself. So as I conclude this conversation, if you are here, the self-knowledge is important for you to engage in a process of healing, knowing what you want, and allowing yourself to engage in a therapeutic process. Thank you.
Thank you. Thank you, Dr. Jean-Pierre. And last but not least, to Charles, all the way from Uganda. You are the chairperson of the National Youth Network called Afrian in Uganda. Please tell us why investing in young people's health is important also for economic growth in our countries and overall in our beautiful continent, in just a few minutes.
Thank you so much, moderator. I think the moderator is doing a good job. Can we clap for her? And she's still young. And thank you so much for the opportunity. I want to appreciate UNFPA Uganda for sponsoring my trip to this place. Rwanda is so beautiful, and I'm really comfortable here. Thank you so much for hosting us, Rwanda. I'm still as well happy that the majority of this congregation are young people, and whatever I'm going to be speaking is something to inspire you young people to be a voice and demand for your rights. Are you hearing me? You should demand for what belongs to you. So about 60% of the Africa's population are young people below the age of 25. If we are speaking about investing in young people, we are actually literally talking about investing in us, because we are the majority. The country I come from, Uganda, over 75% of the population is below the age of 30. That shows you how important we are, because we are the majority. And I'll tell you that if we invest in young people, we are not just investing in them, but we are also investing in the future. The young people are here for a longer time compared to the older generation. The skills we give them, they are going to live with them for a long time. Young people have a lot to lose as opposed to the older generation. So there is a lot that we should do, and it is very important that we set key priorities around health. I want to share with you just some statistics, and this is very undesirable. And I'll use a case study of Uganda because I think I know Uganda better. But it's just a representation of so many other countries in Africa. When you are working in Uganda, If you pass 4 young children, young girls below the age of 19, if you pass 4 of them, one of them is either pregnant or she has a child. What does that mean? It means that 25% of that age bracket, they are young mothers or they are pregnant. So there was a study that was done by UNFPA Uganda, and it says that if the current teenage pregnancy rate is reduced from 25% to just 10%, actually even 10% is still big. It's still big. But if it's reduced to that, about half of the health care expenditure for teenage mothers will be saved. Half of the health care expenditure for teenage mothers will be saved, equivalent to $169 million US. Annually, more than 181 million US dollars will be spent by government of Uganda on health care for the teen mothers and the education of their children every year. That's how much Uganda will be spending, 181 million US dollars. So what does that tell us? It tells us there is a lot we should do to ensure that these girls, and actually also boys, because it's a girl doesn't get pregnant by herself. It's either me or him who will do it, who will impregnate her. So it's important for us to invest in them, not just actually services, but also information. With information, these girls and boys are able to make informed decisions. I have some bit of background in medical, and most of the time when these girls come to us, sometimes they don't know what to do. They don't have information about emergency contraception, and as I think some of them are here. She'll have sex because sometimes we don't have control over that because these are feelings and they're natural, But how do we manage them? Yes, so if you laugh, please go on. You can laugh. So the thing is that we may not be able to control our feelings, but how can we control the way we have sex, So do we have information about contraception? How many of us in government, in April 2001, the AU Commission and all the governments under AU, they passed a resolution and they said about 15% of every country's budget should go towards health. In Uganda, it has never crossed up to 10. I don't know about here. Maybe Honorable Mbabas can tell us. If it was a ministry kind of health event, I would be asking every minister to tell us what the percentage is in their country. But for us, it's been, I think, about between 6 and 8%. And that was a resolution that was passed about how many years? About 20 years. So with the figures I've just shown you, you can see how much we can actually spend if we invest in the health of young people, not just services, but also information, policies that talk about health. Do we have friendly policies for schools? Like, do we have teachers or people that speak to young people about health? Do they know what to do? There are so many young people who abort, and it's not because actually they want to abort, but they are just circumstances. As he was saying, mental health. Most of you ladies, you will tell us that even when you're just in your period, you are not mentally fine, You're moody. Now, some of us who are, in my capacity, at least I've had opportunities to be with lovers. But when they are in that period, they will tell, you know what, I'm not in the mood. Why? Because they are not in the mood. You get it? So it's very important for us to invest in young people with information, but also the services. I want to mention something. There's something very bad about our healthcare system. And sometimes we have facilities, and they are good. But when you walk in these facilities, there are no services. Human resource for health, the ratio is alarming. We don't have healthcare workers, and the population is quite big. So for me, I think I can briefly just share that, but there is a lot to do, and we really, really need to put our monies into the healthcare system and ensure that the girls and boys have information so that they can make decisions, informed decisions. If they want to get pregnant, let them get pregnant when they are well informed than just it being an accident. We are tired of having unwanted pregnancies and unintended pregnancies. Thank you so much.
Wow, wow. Thank you very much to our panelists for sharing and contributing to this conversation. Africa appreciates whatever actions you're doing in your respective communities. Collective action will indeed bring the change and enable us to get to the Africa that we want. So before we take just a few questions, I would like to acknowledge the presence of Mr. Maurice Tayebwa, who is the East African Community Secretariat. Kindly, you can rise up and just say hi to us. And as you do that, I'll just ask you a question, just one quick question, on whether the East Africa community has sexual and reproductive health rights and mental health frameworks to guide its partner states. Welcome, Mr. Maurice.
Yes, thank you so much. Your Excellency, the First Lady, distinguished delegates, and our distinguished panel, thank you so much for the discussions. They were really insightful. And I'll just go straight to answer your question, moderator. Thank you also for the good moderation. Yes, I'm called Maurice from the East African community. I identify as a youth, and I'm in the Social Sectors Directorate, which also deals with youth, children, persons with disabilities, social protection, health, education. It's a whole list. And yes, the ESC has frameworks. First of all, we are guided by the treaty that establishes the ESC as an intergovernmental organization for the 7 countries in the East African region. And this treaty has areas of cooperation. We have areas of cooperation in health and in gender. In health, we have some policies. We have a strategic plan on sexual reproductive health, but also including neonatal and maternal health. And this, unfortunately, has elapsed. It ended in 2021, so we are in its review and developing a second one. We have also a strategic plan, which goes up to 2030. That's on SRHR. But in gender, also we support advocacy at regional level, especially on issues of human rights concerning sexual reproductive health. All of you have heard of the Sexual Reproductive Health Bill, which is currently under discussion in the East African Legislative Assembly. I think we've gone through all the partner states in East Africa to discuss with young people, stakeholders, governments, on how to strengthen the legal framework on sexual reproductive health. But we also have conversations with other regions. The Southern African regions, we have what we call the ISA commitments on sexual reproductive health. And we are in a conversation. We are now into the second round. We had a round which elapsed also last year, and we developed new commitments. We revised the old commitments and developed new commitments. And now we are working with partners. UNFPA is here, but other partners, UNAIDS, WHO, and other UN agencies and governments, to make sure that these commitments are adopted and implemented within the various frameworks at national level. You've heard of the Maputo Protocol. We work with the African Union to make sure that those elements in the Maputo Protocol that touch sexual reproductive health are domesticated in government programs and policies. And for us, all we do is actually to do a review. And related to that, we've developed a monitoring framework as a scorecard for the implementation of the Maputo Protocol. The issues on mental health are still very silent in policy and programming, and I would have loved the panel to bring that out. Mental health, I think the doctor talked about it not being understood very well conceptually, but also in terms of programming, it's still also not understood. But we work with different stakeholders. We have the regional psychosocial initiative, or psychosocial initiative, REPSI, which has developed a community of practice on psychosocial issues and mental health. And this community of practice has academicians, civil society, governments, and we are constantly trying to review how we can better strengthen programming and policy on mental health. So I think I will stop there, and we can engage more. I know at the regional level we could discuss on and on, but thank you. I'm happy to be part of this forum and happy to meet all the youth in the East African region and the African continent. Thank you.
Thank you very much, Mr. Morris. And so we are just about to enter the Q&A session. And I'll just like to open the floor to only 3 burning questions. And so, let me see. So we're going to start with the lady.
I can't even see.
There is there. Kindly state your name, your affiliation, and you can direct the question to the speaker that you would like to answer, the specific question.
Thank you so much. Thank you for this opportunity. My name is Sylvia Mkomwa. I represent Tanzania. And first of all, I would like to congratulate our panelists and also the efforts that are being done by every stakeholder to make sure young people are strong mentally. But I will start by outlining a quote saying, "The early years are important for the experiences that provoke early learning and the relationships that give meaning to those experiences." With the advancement of technology in helping the growth of these young people due to easy access of information, but I believe there is one institution that is yet to be rebuilt in this generation, and that is family as an institution. My question goes to the doctor. All these decisions that we as young people are making or are to make, our biggest foundations are our families, the people that surround us, the people that groom us at home. We're speaking about parents, but at the moment, we leverage technology, digital spaces, to get some of the information, including the sexual reproductive health education. And also, how can we leverage our current families as a strong institution for raising strong mental health youth, and opposing to our culture that also as a challenge to our family to talk about sexual reproductive health education? How do we go back? How do we enhance their role in our community to make sure that we young people are mentally stable and emotional intelligence stable? Thank you.
Thank you very much. Dr. Crystal, you can go ahead and...
Thank you very much for your question. It's a very good question. So you asked about how we can revelate the foundation of a family and enhance sexual and reproductive health and also mental health. And I think with the exposure of young people, as you said, teenagers, adolescents, and the youth to technology, even social medias, so has actually brought an image that a lot of information is there for young people. And the thing is, evidence-based information is not only in the hands of the government, is not only in the hands of people who brought those social medias, but is also in the hands of the family, as you said, as a foundation. That's why I challenged the young people in the room to find ideas and innovations which actually even bring the family in the picture. Because the culture that we hold on and also the discipline and the principles, we got them from the family. But in the many African families, it's very hard to find a parent and a child sitting nowadays and talking about important matters, and that includes sexual and reproductive health and mental health. That's why I challenged young people to bring innovations which can actually attract young people to get evidence-based information in a friendly and fun, interactive way, but which is safe, like a safe environment where they can get those information. I know it's going to be challenging because it's competing with the other information which is already there, but it's up to us to make it attractive as those other information which are not healthy are. And I also welcome parents in the room to actually know that you have to work together with the government in order to bring upon those information to young people. I liked how it was written on every corner of the room: connect, innovate, and invest. Because connecting, innovating, and investing is not only in the hands of the government, it is in the hands of the families, in the hands of the parents, but most especially in the hands of today and the future, and that's us young people. That's why in Innovation Accelerator Program, I liked how we started as 3 winners, it became 4. It would be nice to have so much more young people encouraged and invested in order to bring upon those innovations. Thank you.
To the second question, I'm gonna give it to a gentleman, the one who has raised both of his hands.
Hello, everybody. My name is Dr. Shoaib Abdullah Hassan from Somalia. This is my 5th time coming to Youth Connect Africa. And just wanted to mention 2 things. This is not a question directed to the panel, but I think it's very important to mention this. We are talking about resilience youth, resilience Africa. So back from home, Somalia, I think we are the most resilient youth there, studying, surviving, and also developing. And I had more girlfriends than having male friends. Why I'm saying this, there are 3 elements I came out that youth need. Number 1, youth need trust. They need the trust to go to a hospital, especially girls from Muslim countries. And I don't know why Youth Connect is not giving more platforms to the Muslim culture or Islamic culture. That is where we have more girls and more, a lot of more. But that's just for a comment. Now they need trust to the doctor, to the gynecologist, or to anybody who's working in the health sector that they can talk to, especially the problem back home or environment. And then people need to engage youth. They need engagement, to listen to their stories, to sit with them, to set a good time for them, especially psychology and psychiatric departments, where most of the government don't put a lot of money, and in Swahili they call mondo wazimu. Even a doctor from PhD sitting there, psychology and psychiatric specialist, the one who's supposed to be given the platforms and talk to the people, some society see them as a doctor for the mentally ill people or for the mentally disabled people. So that culture also should be looked into, and then more of psychological and psychology and psychiatric clips or videos to be played in schools, hospitals, so people interact with these stories behind the mental issues. And the third point is, now, after trusting in the youth, both sides, they trust you and you trust their stories, you involve them, you listen to them, then now you engage with them. This means we will have more mental stories to be on place, and then that way, I think more of this topic will be covered. Thank you, whoever is putting a lot of energy and resources into this chapter. Thank you so much. I just wanted to contribute to that, and thank you, everybody.
Thank you very much. And to the last question, I'm going to give a young person on the high table. I want to say the high table. And so, any hands? The lady with striped and a black, I think it's a dress. She needs a microphone.
Hello.
Hello.
My name is Amania from Central African Republic. I will be speaking French because my English is so bad. So, I have one question for Dr. Jean-Pierre. In French. So, comment identifier une personne qui a des problèmes mentaux? Parce qu'on a la majorité des jeunes qui ont des problèmes mentaux, mais qui ne le savent pas. Et quel est votre message pour eux afin de leur motiver d'y aller voir le psychologue? Parce que certaines personnes, elles ont honte d'y aller voir le psy pour dire moi je suis fou et des choses comme ça. Et puis, secondo, qu'est-ce qui vous a poussé à faire dans la médecine beaucoup plus vous spécialiser en santé mentale? Je vous remercie.
You can go ahead, Dr. Pierre.
Thank you so much. I will be answering in English. Do you want to read the question in English first? But I can also answer if that's okay to start by there.
In just a few minutes, you can go ahead.
All right. So how do you identify when someone is going through mental health challenges? That's where we need to start. And I have seen that in different spaces where people feel like, okay, because in most of the time, we meet on the street, in the churches, in the schools, at work, and we are all, most of the time we look like smiling and healthy, but sometimes we have some mental casualties among us, myself, yourself, someone else, but that can't be seen easily, as you can see other injuries most of the time. So, one, identifying someone who is going mental health issues, when it comes to mental health illness disorders, it is something that is only approved or kind of diagnosed by a mental health specialist. However, in terms of the preventive measures, here I'm saying that to make sure that you don't see someone here or on the street or your colleague and say, hey, you are mentally ill. However, we can identify when someone is going through mental health challenges, especially it requires to know that person. So if you know that person, you can start to see that something is changing. The way they behave, the way they react, the relationship with themselves and with others have changed. A few things I'm going to recommend. So first, step number one, be self-aware. The self-knowledge helps you to know, even sometimes you may not even know that yourself is going through mental health challenges. You may think that is who I am. I'm a bad person. But first step, self-awareness helps you to have self-compassion. Forgive yourself for some mistakes that you may have done because of those mental stresses. So knowing yourself is a step one that helps you seek support as well. Know yourself, self-knowledge, you get supported through that step one. There's also support for that. Self-help, second, learn how to regulate or cope with your distress. Sometimes these accumulation of stress end up being mental health diseases. Learn how to cope, to regulate the stress. Third,
Hoping it's the
there is
last
a
one.
power in collective healing. The concept of Ubuntu, your wellness depends on my wellness. We need to leverage it in African cultures. Seek mental health support. There's a clinical support in hospitals, health centers, but also those collective spaces. There's also online therapy. If you have a fear of going into those buildings sometimes because of the stigma, online therapies also exist. You are not alone. Thank you.
Thank you very much. And just to conclude on what has been said, financing, innovation, collaboration, and advocacy are key to ensure that we bridge the existing gaps in sexual and reproductive health rights, mental health, and economic empowerment. Thank you very much to our speakers, and peace. You can join the rest of the team. Thank you.
Please help me appreciate the panelists and the powerful moderator. And for those of you following us online, keep the reflections, the questions, and the comments coming using the hashtag YouthConnect2022. Ladies and gentlemen, are we ready for yet another refreshing performance from Michael? Are we ready? Are we ready? Michael, please.
umusiga uko yaje yewe iyaya no kuva iwanyu kagiwa abandi n'agahinda abana bari muderi bari mudera abana bari muderi bari mudera abana bari muderi usezeye ku rukundo yewe usezeye ku rukundo yewe yaya no kuva iwanyu kagiwa abandi n'agahinda abana bari muderi bari mudera abana bari muderi bari mudera abana bari muderi bari muderi abana bari muderi bari mudera abana bari muderi usezeye ku rukundo yewe usezeye ku rukundo yewe urukumbuzi murajyana yewe iyaya no kuva iwanyu kagiwa abandi n'agahinda abana bari muderi bari mudera abana bari muderi bari mudera abana bari muderi bari mudera abana bari muderi
Asante sana, merci beaucoup, Michael. Another round of applause for him. Excellencies, fellow young people, ladies and gentlemen, all protocols observed. Akaryoshe ntigahora mu itama. We are unfortunately getting to the end of this exciting and insightful session. So please allow me to invite on stage Ms. Lydia Zigomo, the UNFPA Regional Director for East and Southern Africa. You're welcome.
Your Excellencies, Madam Jeanette Kagame, First Lady of Rwanda and Chairperson of Mbutu Foundation, Honorable Rosemary Bambazi, Minister of Youth and Culture for Rwanda, Honorable Tabia Maulid Mwita, Minister of Information, Youth, Culture and Sports for Zanzibar, Honorable Emma Kantema Gaumas, Minister of Sport, Youth and National Service in Namibia, representatives of the East African Community Secretariat, thank you, representatives of development partners, distinguished colleagues from the United Nations family, young leaders and young innovators, dear panelists, particularly Dr. Christelle, Dr. Jean-Pierre and Charles, and participants, members of media houses, ladies and gentlemen, and all the young people here. Good morning, or is it now actually afternoon? It has been a great honor for me to be able to join you in person at this year's Youth Connect Africa Summit in Kigali. I was inspired by the words of our guest of honor, Her Excellency Madam Jeanette Kagame, on particularly the sort of focus on looking at the whole of the human being, the whole of a young person, and understanding the need for us to make sure that we're actually supporting young people in all aspects of their lives. I was also struck by the words around the connectedness of sexual reproductive health and mental health, and the importance that was placed by some of the panelists in ensuring we make those linkages much clearer. And that without mental health, good health, there can be no wealth for our continent. I was also inspired by the words of hope, and we need words of hope at this time, that Her Excellency stressed, and the potential that exists in our young people for the solutions to the problems we face as a continent, but also beyond that, to turbo boost us to the next century. That is going to be in the potential ideas, innovations of our young people. And therefore, a healthy nation and healthy young people is our route to a wealthy nation and wealthy Africa. I'd like to start by I'm particularly pleased actually to listen to the inspirational panel that was here present, and the fact that they were addressing issues that are also close to my heart in the case we need to make in investing in young people's health. And I'd like to start by expressing gratitude to the government and people of Rwanda for hosting the 2022 Youth Connect Africa Summit under the leadership of the President of the Republic, His Excellency Paul Kagame. I congratulate the co-organizers of the 2022 Youth Connect Africa Summit and commend the partnership between UNFPA, Mbutu Foundation, the YCA Hub, and other stakeholders for organizing such an exciting and meaningful high-level panel. I know that those of you in this room surely already agree on the importance of addressing sexual and reproductive health and rights and mental health as a pillar to any youth development programs and strategies. Still, we must speak about, so together we find the best ways to integrate this topic, because we also heard about the challenges that face us in demystifying concepts of sexual and reproductive health and rights, and also the stigma around that and of mental health that was eloquently expressed in the contributions from the panelists. And therefore, the struggle continues, and the work needs to be an area where we collectively focus our efforts to ensure that we can make those connections clear in the communities we live in, amongst the people we work with, in the health sector at large, and in the development sector as well, if we're going to see progress in this area. Today, we have listened to young people, experts, decision makers, and leaders. Sexual and reproductive health and rights and mental health are fundamental human rights, which we must protect, promote, and enforce. They were recognized as human rights for the first time in 1994 during the Maiden International Conference on Population and Development, the ICPD as it's called, held on our continent in Cairo in Egypt. The ICPD Plan of Action stipulates clearly that all individuals, especially women and young people, must be provided with quality information to make decisions that concern their reproductive health, to have a safe and satisfying sex life, have the ability to reproduce, and must have the right to decide if, when, and whom to marry. The same ICPD Plan of Action clearly makes reference to mental health, and specifically reproductive mental health. Excellencies, ladies and gentlemen, there's a direct link between people's ability to enjoy these rights and their level of socio-economic empowerment. Thus, sexual and reproductive health and rights, good mental health, and women's and youth's empowerment are interdependent and essential for socio-economic progress, sustainable development, poverty eradication, and gender equality. When in 2019, stakeholders met at the Nairobi Summit to mark 25 years of that landmark population conference, ICPD, the leading thread was to accelerate the accomplishment of the unfinished business of the ICPD. The summit ended with the voluntary commitments to accelerate the implementation of the forward-looking SRH agenda to meet the Sustainable Development Goals and targets by 2030, and many governments represented here in this room made those commitments. Some of the commitments specifically were focused on investing in the education, employment opportunities, including family planning and sexual and reproductive health services of adolescents and youth, especially girls, to harness the promises of the demographic dividend fully, just as outlined in the 4 pillars of the African Union Roadmap on the demographic dividend. The catalytic impact of SRHR on young girls' ability to complete their studies and avail of economic opportunities cannot be overemphasized. When a young schoolgirl finds herself with a pregnancy that she did not plan for, her prospects of attaining her full potential are drastically reduced overnight. An unintended pregnancy is a nightmare for a young woman who just landed her dream job. I'm truly encouraged, therefore, to see and hear young people take leadership, share innovative initiatives to create jobs across different sectors, including the creative industries of film, music, and we had beautiful performances from Michelle just now, arts and culture, and technology. Access to sexual and reproductive health and mental health information and services is a shield and an enabler to those dreams. As we learn of these innovative experiences and best practices, the question is, how do we scale up for a more significant impact? That is where, in my view, like-minded institutions such as ILO, World Bank, UNFPA, Mbuto Foundation, and others come in. Particularly, allow me to take this opportunity as I end to thank all our development partners, without which so many of the results achieved to date could not have been possible. Specifically, I would like to acknowledge the Korean International Cooperation Agency, KOICA, and the Swiss Agency for Cooperation and Development, SDC. In conclusion, I'll say to you, the evidence is very clear. There's never been a better time for all of us to live up to our beliefs and promises. We must put our money and efforts where our interests in scaling up interventions in SRHR and mental health as a necessary bridge to get to the much desired economic empowerment of millions of Africa's young people can be achieved. We cannot ignore the human natural progress of growth, even as we search for the higher ideals outlined in the SDGs and the Africa we want of the Agenda 2063. The young people of Africa are ready. The time is now. UNFPA is committed from our side. I hope you are too. Thank you.
Another round of applause for her, please. Your Excellency, First Lady, ladies and gentlemen, we will conclude our session with 2 group photos. For the first one, please allow me to welcome on stage all our panelists and the moderator. Yes, please come forward. The UNFPA representative, Rwanda. UNFPA representative, Tanzania. The UNFPA regional director for East and Southern Africa. Mr. Maurice from the East African Community. Honorable ministers, our very own Honorable Rosemary, please, to be joined by our guest of honor, Her Excellency, the First Lady of the Republic of Rwanda.